Hi, today we're going to talk about hips. In hip arthritis, the issue is that there's been some sort of problem that has been long-standing, although you could have a hereditary cause for this as well, where the joint is unstable and it just moves a little bit too much and it causes excess bone growth right here or around the entire 360 degrees around it, and it leads to x-ray changes. The x-ray changes, along with cartilage that lines the inside of the joint, we call this articular cartilage, can cause restrictions in motion in the joint, as well as pain with walking or standing on the joint. And typically what people are told to do is get a steroid shot, do some physical therapy, and perhaps have a joint replacement. However, if you get treated on the early side of your hip pain and you decide, hey, is there something more proactive that I could do? There are other things like prolotherapy, PRP is the second tier, or stem cell, which is third tier, that can be used to help preserve the joint. We can't say that we use to cure it because the FDA doesn't allow us to say that, but we can help preserve the joint for a longer period of time and perhaps even abate the need for a joint replacement. The key with treatment of any type of joint is that if you just put the medicine, whatever you're injecting, inside the joint right here, which is a really small space, that may not be enough to treat it. The entire joint is covered with a capsule and it extends down around 360 degrees around it. In addition to the capsule, or as part of the capsule, are these ligamentous structures which come up and support the front and the back side of the joint. And sometimes the issue with the whole problem of the joint when it's unstable and not able to rotate in the joint correctly is that the ligaments have been injured in the past. So this is where the whole concept of prolotherapy came from. And the goals with treating prolotherapy are to treat the structures surrounding the joint, including the capsule, the ligaments, some of the tendons that can cause injury or that have been injured and may have led to the development of arthritis. So, for example, here's an attachment where a couple of your muscles attached to. Here's another one. This whole area is where your adductor muscles can attach to. On the back side, there's some other areas where the adductor muscles can attach to. The capsule comes around into here. There's a lot of ligamentous structures that attach to the back side of the hip here too. All of those areas need to be treated. And if they're not all fully treated, then you get incomplete treatment if you're getting PRP or prolotherapy. If your disease is more advanced and you need stem cells, there are a few things that we use to augment that, and we can talk about that if you're a candidate. Usually stem cells are reserved for more advanced disease. I'm Dr. Jennifer Stebbing. I'm a sports medicine, regenerative medicine doctor, physician, and I'm happy to help you with any other questions you have. Please see my website, drstebbing.com, and you can book a 15-minute free consultation if you're interested. Thanks.